Exercise is one of the most important things you can do for your heart health at any age. It's just as important as taking your medications and following a heart-healthy diet. Regular exercise is very beneficial. It helps the heart to work more efficiently and helps the creation of tiny new blood vessels which assist clogged or diseased blood vessels. Regular exercise helps to improve your risk factors for heart disease by decreasing blood pressure and improving your cholesterol panel. Regular exercise also helps to reduce body weight if needed, reduce stress, promote psychosocial well-being, improve sleep, improve cardiovascular function, and improve mobility, balance, and coordination. Exercise regulates blood sugar for people with diabetes. Finally, exercise decreases the risk for future cardiovascular disease, diabetes, osteoporosis, and some cancers. Along with all of these benefits, exercise is particularly helpful for people who have been recently diagnosed with heart disease to return them to their usual lives, activities, and responsibilities. When beginning an exercise program, it is best to start slow. Begin with 5 to 10 minutes of exercise 3 to 4 times per day. The goal is to work up to at least 30 minutes of exercise 5 days per week. Walking is the safest and easiest exercise for most people following a recent hospitalization. If you can't walk outside, try walking inside your home or at a local shopping mall. Your intensity level should be at a low to moderate level. The rating of perceived exertion, or RPE scale, is a good tool to use to determine how hard you are working during exercise. 6 is the number you would give for resting, seated in a chair, and 20 represents the most exercise you can do. Try to keep your RPE in the fairly light to somewhat hard, or 11 to 13 range. You can use the talk test to gauge exercise intensity. Choose a level of exertion that allows you to still talk while you exercise. You should be able to talk in short sentences, but will probably not be able to sing. At the end of your exercise routine, you should feel like you've done something, but shouldn't be extremely tired. Make sure to add a warm-up and cool-down for 3 to 5 minutes before and after your exercise routine. Slower walking is a good activity for your warm-up and cool-down. Remember, any exercise is better than none. If you can only walk for 2 to 3 minutes, that's okay. Maybe try another 2 to 3 minutes in a couple of hours. Exercise will get easier with time. Please consider ways to add activity into your life, such as extra walking, biking rather than driving, using the stairs instead of an elevator, parking farther away from the store, and hand washing dishes instead of doing a dishwasher. You are unlikely to experience any problems when exercising at the low to moderate level. It is normal to feel that your heart is beating faster, that you are breathing faster, and you may sweat. However, if you experience any of the following symptoms, please stop exercising immediately. Severe chest, back, neck, arm, or stomach discomfort, excessive shortness of breath, dizziness, lightheadedness or blurred vision, excessive sweating or nausea, frequent skipped beats, cramping in your arms or legs. If these symptoms do not improve within 5 minutes, you should contact your physician and/or consider taking a nitroglycerin if this medication has been prescribed to you. There are times when you should not exercise. If you have missed any medications, if you are not feeling well, if you have had any significant weight gain over 2 days or have ankle swelling, or if you have had chest pain recently. Please use caution when exercising outdoors in weather extremes. If the wind chill is below 0 or the heat index is above 85 degrees, try to exercise indoors instead. Outpatient cardiac rehabilitation is an important component of your recovery and is covered by Medicare and most insurance companies. Research shows that participation in cardiac rehab reduces cardiac mortality by 25%. Cardiac rehab is a disease management and treatment program designed to optimize physical and psychosocial functioning, reduce the risks of future heart problems due to heart disease, control cardiovascular symptoms, halt the progression of heart disease, and enhance quality of life. Cardiac rehab usually involves ECG-monitored exercise sessions and risk factor education. Cardiac rehab staff will help you develop an appropriate exercise prescription and build on whatever exercise program you have started since your hospitalization. Many cardiac rehab participants enjoy interaction with and support from other participants in the program. Most cardiac rehab programs will work with you over a period of 3 to 12 months. During the first 12 weeks, your visits will be more frequent. The main goal of cardiac rehab is to help you develop a personal plan to guide you through the recovery from your heart event and assist you in avoiding future heart problems and becoming a good caretaker of your health for life.